I've been really doing well. So I attribute that to your treatments of me.
Thank you. I think what acupuncture do for the cancer patient is different from the chemotherapy or radiation therapy, because what the chemotherapy, like the traditionally conventional treatment we gave you, chemotherapy, radiation therapy is to kill the cancer cell. We're trying to kill the cancer cell, right? But the acupuncture basically trying to build up our body immunity. So when you increase your white blood cell, you increase your immunity, the whole body start motivate to fight with cancer. And that's the, I think it's a very good supplement from the past, from the patient I've been in contact, I find out when the patient get this treatment, they can become higher immunity and get a better quality of life. And also at the same time, I generally give every patient some nutrition counseling. Just like before we talk about
I was going to say that
a lot of food we've been discussing.
Your nutrition advice has been just amazing, and my face will eat my raw clove of garlic every day. Some days I eat 2 raw cloves of garlic, and so yeah, I think it's because you've built up my immunity and your nutritional advice, and I have changed my diet a lot. I've cut out a lot of stuff that maybe I used to eat, like with a lot of fats and stuff in it, and you've given me advice of what are the good fats to eat and everything. So yeah, I'm doing well. And
basically what we're trying to build up is, number one is we're trying to make the whole body good circulation, because acupuncture can give us good circulation, and which when you have good circulation, your body can reduce the chronic pain and the chronic fatigue, and also can sometimes help when we need a better sleep and better eating, like appetite, right? Also acupuncture can be very good to treat if any patient with chemotherapy. Sometimes patient can get very low appetite and feel nausea, vomiting. Those kind of symptoms is also very good to treat by acupuncture. And also recently I find another patient, because she checked after 3 months she's been doing it. Right now she has a brain tumor, now shrink to almost normal size in 3 months, which I feel very happy, because she used to be very depressed, and this lady, she worked in the telephone company for 25 years, and eventually from the workplace she developed this brain tumor, which brain tumor is one of the very difficult cancer to treat.
It was they told me right from the start that they would save chemotherapy and radiation for me when I needed it to improve, my quality of life as far as to alleviate the pain and stuff. But I don't think I'm ever going to get to that stage, because I think you're doing a great job at keeping the tumors from growing. And I mean, obviously here I am almost 3 years later, and I'm feeling great.
And also I think part of the improvement from you and from I believe is because your emotional change, because I find out when we doing this treatment together, and also patients tend to get more positive, right? Because when you need to see a hope, you need to see there is a treatment available, and you can improve your symptom, and then when you emotional get more positive way to fight, and then your whole body immunity also at the same time increase.
And I think the acupuncture and the nutritional counseling, and I've been doing a little bit of relaxation and meditation really helps too. Your state of mind, certainly does help.
And also, Peter, I just hope you can talk about how do you feel like when you do the needle. Do you feel anything like very painful or very dangerous?
No, it doesn't bother me at all. In fact, and when I walk out of here, I just feel relaxed. I feel like I've just had a real energy boost.
I know for the past few years, like you never complained of pain. Maybe you just didn't say it, but
no, there's been no pain, and it's actually.
They say you feel some tingling, numbness.
Well, I used to have a little tingling and numbness in my hands, but I think that's just the way I was holding them, and I haven't had that, or maybe I'm getting used to it. And as you can see, that one needle is bouncing, so it's really stimulating everything.
See, this needle right now is like making a little bit dancing.
And some of the times they bounce without having even hooked them up to the current, but I do know that the current does help. And but you don't feel anything. I mean, you can crank it up. I'm sure that it would be too much, but you don't do that.
And
so.
also because we use needle only one time, so there's no chance for infection.
No.
Like every time you need to clean the, with alcohol, clean the skin first and then do the one time use needle, and then, so in that case we can, just guarantee the patient there's a very safe
that's right.
treatment. There's no infection going to happen if you use just one time needle.
Well, I know a lot of, like some acupuncturists reuse needles because they're stainless steel, but this way you don't have to.
Very dangerous.
Well, it is. This way I know that you don't have to worry about them because you throw them away and use new ones.
Yeah, we always use the pre-sterilized needle, and this little machine actually you don't have to use it. I use this only because right now here the patient usually come once, twice a week, and it's not like in China if the patient come every day we don't even use the machine because they only come in the morning. We do 10 minutes, they go home. And they go to work, and after tomorrow morning they come back again. So in that case, if you come every day, you don't even need this machine. Just give a little bit more constantly, higher treatment. I hope I can, because you come once a week, I want to give you a little bit longer treatment, just for better result. And for chronic pain, acupuncture is also very good to control the pain and also the symptom of if you feel the body numbness, tingling, and. So now what we do is we do once a week, and because Peter right now you feel basically normal, right? Did you go back to work? Yeah, so you go back to work, and you also have good appetite, and that's what we do is we trying to change the cancer. When we fight this cancer, like cancer used to be scared every people because it seems like a life-threatening disease, but we're trying to change it to a chronic medical, problem, just like diabetes, high blood pressure. So we get some treatment we can deal with, we can fight with, and we can give more hope, to the patient. Just we doing this hope more patient can get information, and so hope people. And now acupuncture can cover for some of the insurance. The only thing is if people really have financial difficulty. I hope they can call us and maybe we can try to find some way to solve the problem, because the only thing is right now we can give the receipt, but some of the financial company cover acupuncture, not every insurance. Just hope later more and more company